Hello, everyone, and welcome to today's edition of our Farm Quick Conversation series. Today we'll be focusing on pain mitigation providing for disbudding, and I'm joined with Dr. Hans Coetzee from Kansas State University School of Veterinary Medicine. Before we get started, just a quick reminder about our quick conversation series. This is something that we started last fall and really was an opportunity that we saw to engage directly with the producer community to allow you guys and producers to ask questions directly of staff members and other subject matter experts on issues pertaining to farm program standards, expectations, and other things related to on-farm management. So we strongly encourage all those who are listening in to submit questions either through Zoom, if you're watching on the Zoom link, or through Facebook. You can see there at the bottom of your screen, if you're tuning in on Zoom, you can hover over the bottom and those two options will pop up either through the chat option or the Q&A option. You can submit questions there or in the comment sections on Facebook. We strongly encourage questions. We have provided a few questions that we hear quite a bit related to this topic to Dr. Coetzee already, and he'll start with those questions, but if we have some time at the end, we'll definitely share those questions and ask those of him as well. Before we get started and I turn it over to Dr. Coetzee, just wanted to remind those that are listening in of what the expectations are for Farm Animal Care version 4. As a reminder, Farm Animal Care version 4 began January 1, 2020, and with the extensions due to the pandemic and to COVID will be enacted until July of 2024. And that expectation states that all calves are disbudded before 8 weeks of age and that pain mitigation is provided. As a reminder, the farm program is outcomes-based, so how pain mitigation and what pain mitigation is provided is up to that relationship between the dairy producer and their veterinarian. So that's one reason that we have Dr. Coetzee here to explain a little bit more about what those options are and how we know the best ways to implement a type of mitigation when disbudding. So Dr. Coetzee, I'll turn it over to you if you'll start with a brief introduction before we get started on the questions we provided.
Thanks, Beverly. I appreciate the opportunity to be with you today and to visit about some of the work that we've done in the area of pain mitigation. So my name is Hans Coetzee. I'm head of the Department of Anatomy and Physiology here at Kansas State University. And my background is that I was a practicing veterinarian for 5 years and then came back to college to do a PhD at Iowa State. And I've been on faculty here at K-State in this role for the past 5 years. So if you want to move on to the next slide, Beverly. So that's just a summary of some of my current disclosures. It's always good to start off acknowledging funding from USDA. Primarily, I've also served as a consultant for several pharmaceutical companies, and I have a couple of patents. And none of these relationships impacted the data that I will be sharing with you today. And all the research that we did on animals was reviewed and approved by ethical oversight committees at either Iowa State or K-State. Next slide, please, Beverly. So broadly, what we're going to discuss today is we'll start off just highlighting the differences between disbudding and dehorning. We'll then talk a little bit briefly about strategies for removing the horns in calves, and then set the stage for why pain management is important to consider when thinking about dehorning and disbudding. We'll talk a little bit about the work we've done to try to assess pain, but the real focus of this presentation is how do we go about minimizing pain on dairy operations. And I'll talk about a framework that we use called the 4 S's, where the first point is really to try to find a way to not have to perform the painful procedure to begin with, but if the procedure has to be performed, how do we go about doing so safely and in a way that reduces the pain and stress on the animals involved. Next slide, please. So to start off, these two pictures here show the difference between disbudding and dehorning. So disbudding is the process of removing the horn-forming tissue or the horn bud, and that usually attaches to the skull of the animal after about 2 months of age. And so the reason why the farm program recommends disbudding before 8 weeks of age is because that's the period of time when these horn-forming tissues have not yet attached to the underlying bone. And so it really minimizes the stress on the animal when you remove just the tissue and you don't have to impact the bone that lies underneath that tissue. After 8 weeks, the horn-forming tissue is actually attached to the bone, and the frontal sinus from the skull actually starts growing into the horn. And at that point in time, it becomes a far more complicated and far more painful procedure. So we strongly advise and encourage producers to remove the horn bud before it attaches to the skull, and that procedure is called disbudding. Next slide, please, Beverly. So there's several approaches to removing the horn bud. The two most common in the industry are either removing the horn bud with a hot iron, and that's called cautery dehorning or hot iron dehorning. And the second procedure is to remove the horn buds with caustic paste, and that's typically done when the calves are very young, less than 1 week of age. We strongly discourage the use of caustic paste in older calves because it's just not as effective. And then a third approach that our group is currently investigating is the use of a laser to try to remove the horn bud, and that's some research that's being led by Dr. Mike Kleinhans in our research group. And Mike has a paper that will be published here in the next month or two, focused on assessing the use of a laser to try to remove that horn bud tissue. But certainly the two most common approaches are the hot iron and the caustic paste. And both of those approaches and the laser cause pain during that procedure. And so we do need to consider that as we do these procedures in these young calves. Next slide, please, Beverly. So the question as to why are we discussing pain relief and pain management is that pain management has become a consumer expectation. As we look at many of the retailers out there and the folks that are buying the products we produce, they have starting to put in place standards and expectations, which are largely driven by consumers, that are requiring us as livestock producers and the livestock production community to really take seriously the ethical considerations of some of the painful procedures that we're performing. And so one of those would be dehorning. The other, of course, would be castration or disbudding, as well, as we've talked about. And so in order to be able to maintain consumer confidence in the products that we produce, it's critically important for us to take seriously our obligation of ensuring that the procedures that we perform are done so in a way that reduces the stress and the pain on the animals. Next slide, please. And as Beverly has already highlighted, this has become an expectation of the Animal Care version 4.0 from the farm program, that pain mitigation is expected when calves are disbudded using any method, cautery or paste. And it is also expected that producers will work with their veterinarians to determine the appropriate pain mitigation for disbudding. And so this is the critical part of this presentation today, is that currently we don't have any FDA approved drugs that are specifically labeled to relieve pain associated with disbudding. And so that requires our producers to work with their practicing veterinarians to use these drugs in an extra label manner to minimize the pain associated with these procedures on the animals and their care. Next slide, please. So this is an important slide because when we're talking about pain management in any livestock species, and dairy calves in particular, assessing that pain is quite difficult. So our livestock species have evolved, they're prey animals. And so in the wild, it's in the best interest of the animal not to show signs of pain. And so livestock do a really great job of concealing signs of pain. And so it can be quite difficult for us to assess if an animal needs a pain relief drug or not. But I'm going to show you in the next few slides some of the tools that we use to assess pain in livestock. As I've mentioned already, there's currently only one drug that has pain relief on the label for use in cattle, and that's a product called Banamine transdermal. And this contains an active ingredient, flunixin, that's applied to the surface of the skin, and that alleviates pain by being absorbed through the skin into the bloodstream of the animal. And the pain that is specific to the label of transdermal flunixin is pain associated with foot rot in cattle. So when you use this drug to treat foot rot, that is according to the label. But if you want to use this drug to treat pain associated with castration or dehorning or disbudding, that requires extra label drug use, which really necessitates a really good relationship with your practicing veterinarian so that they can discuss those options with you. Other challenges that we face with the drugs we have approved is that there's a time delay between when we give the drug and it has its activity. And the best example here is when you go to the dentist and you have a cavity and they want to fill the cavity, they're going to inject a local anesthetic first, but it takes about 5 minutes or so for that drug to have an effect before it's safe for the dentist to continue the procedure in a pain-free manner. And it's exactly the same with our livestock species, as when we administer a local anesthetic, it does take a few minutes for that drug to take an effect. And that will require very often for our producers to inject a group of calves with the local anesthetic first, and then to come back and start the disbudding procedure after the drug has had an opportunity to start working. Other challenges that we face is some of the drugs we have available are not very convenient to administer. Some of those drugs are only approved for intravenous use, and the injectable formulation of Banamine is an example of a drug that can only be given by intravenous injection. And we'll talk a little bit about a drug later on called Meloxicam that we typically give by oral administration as a tablet. Some of the drugs that we use have a very short duration of activity. And so in order for them to be effective in reducing pain, they may need to be given more than one time. The advantage of Meloxicam is that it has a very long, what we call half-life, which is the time it takes for the drug concentration in the blood to be reduced by half. And that's a very long period of time with Meloxicam. So that single dose is sufficient to be able to provide pain relief in calves. Of course, there's the cost associated with the meat and the milk withdrawal period, especially our producers in the dairy industry are very familiar with milk withhold periods and the potential economic implications of that in lactating dairy cattle. And then we also are faced with the challenge of treating chronic pain associated with lameness in dairy cows, and that's another consideration for livestock producers to consider when treating lameness in dairy cattle. Next slide, please, Beverly. So this is just a quick slide that I wanted to share with you to highlight some of the challenges around getting drugs approved as pain relief drugs in dairy cattle. The FDA recommends that those approvals are based on the use of validated methods of pain assessment. And as I've mentioned already, there are several ways that we try to measure pain in livestock, but all of these can be very challenging for us in livestock production systems. So this sort of places some context around some of the challenges that pharmaceutical companies are facing in getting these drugs approved for use in dairy calves. Next slide, please. So I'm going to talk a little bit in the next few slides of how do we know that it hurts? What can we use to measure pain in the calves to understand the benefits of giving these pain relief drugs? Next slide. So probably one of the most common methods is just to look at the animals and see how they're behaving. And as livestock producers, you're very familiar with this method of pain assessment, is you look to see whether the calf is up and eating at the feed bunk, spending time around the other calves, whether their calf is engaged in pain behaviors. And then just by looking at the face of the animal, there are these facial grimace scales that are being developed that are proposed as validated methods to assess pain in the animals by looking at how much the muscles around the eyes have contracted so that the eyeball space looks smaller, and how much you can see the muscles in the face tensing up, which are some of the more common signs of pain. In addition, there's some of the other behavioral factors of these animals is that they can be kicking at their sides, they can be wagging their tails back and forth, and those are all signs that an animal might be in pain. Next slide, please. This is one of the technologies that we've been spending some time studying to assess pain. And so you'll notice here's a calf with a halter on, and you'll notice that the color has just suddenly changed in the skin of this animal. And this is an assessment of skin temperature using a device called a thermography camera. And so the thermography camera measures changes in the blood flow to the skin. So you'll notice, especially around the eye of this animal now, it's mostly dark red colors. And at this point in time, right there, the animal experienced a surgical castration. And you'll see how the blood vessels in the skin have contracted, and the color has changed from those dark reds to mostly yellows and greens. So if you watch this again, it's going to loop through, and you'll see, especially around the eye, it's mostly red now and dark red colors, but then you'll see at the point of castration, the blood vessels contract, the blood flow is driven away from the skin, and we can assess the temperature of the skin with the thermography camera, and with the software that we have, the change in temperature can be used as a proxy or surrogate marker of the amount of pain that the animal is in. So this is a very interesting and a very valuable tool to try to assess pain in animals based on the changes in the skin temperature associated with the blood circulation changing in response to pain. Next slide, please. Some of the other tools that we've used is to measure brain wave activity. And so the name for this is electroencephalography. And so you'll see in the top right-hand corner of the slide are 4 different wave patterns, and those are commonly what we'll measure in these calves to try to assess pain. And so the first wave pattern is called the beta wave, and that's more common in animals that are anxious or alert, or people that are anxious and alert. So when I'm giving this presentation to you via Zoom, I probably have mostly beta wave activity in my brain. Whereas as the listener, you probably have mostly alpha wave activity, indicating that you're more relaxed. In some cases, since we're about 5 minutes into this presentation or 10 minutes in, you might have more theta wave activity, which is what you'll find in people that are drowsy. And those of you who are dairy farmers that have been up since 3 o'clock milking cows, you might have some delta wave activity, which is usually what we associate with sleep. So those are the wave patterns that we measure in these calves. And this is really just assessing the electrical activity on the surface of the scalp. And you'll notice in these 6-week-old calves, the red line represents the point of surgical castration. But you'll notice that not all of the wave activities have changed. On some of the leads, we've seen a bit of a change towards beta wave activity. But on many of the leads, the wave activity stays fairly consistent. And so this is the pattern that we see with very young calves. Now, if you look at the next slide, you'll notice after the red line, the animal's wave activities have changed significantly from most of those alpha and theta waves to beta wave activity, where the waves are much closer together. And this is 6-month-old calves experiencing a castration procedure. So if you compare those 6-week-old calves with 6-month-old calves, you can very easily conclude that it's more important to do these procedures when the animals are younger, because that helps us to minimize the amount of painfulness around the procedure and the amount of pain that is processed by the brain of the animal. So if you could maybe go to the previous one, Beverly, just as an example again. So that's 6-week-old calves, not a lot of change in the wave activity after the red line. So if you can switch back to the next one, 6-month-old calves, you'll notice all those waves have changed in their activity. And that indicates that it's best for us to do these procedures in the animals when they're very young, because that minimizes the pain and distress on them. Next slide, please. So the last example of a pain assessment method that I wanted to share with you is to measure the gait of the animal. So the pace of the animal, the speed at which they cross over a mat. And this is an animal that has a temporary lameness. So it's only a lameness that lasts for a few hours. But we can use the system to try to assess whether the drugs are working in the animals by looking at how much weight or force that they're applying to their legs as they cross over the mat. And so you'll see there in the slide that I've shown there in terms of the pain relief drugs, the pain relief drug does have an impact on the gait length or the stride length of the animal compared to animals that are dehorned without pain relief. So we can see the effect of the drug by just looking at the changes in the way in which the animals are walking across the mat. Next slide, please. So now we're going to get down to the nuts and bolts of what can you do to minimize the pain. And I want you to think about this in terms of these 4 S's. So the first is to suppress the source of pain. And the most common approach that we're considering in dairy farms is the use of pole genetics. Now, currently, we know that the bulls that carry the pole gene maybe produce daughters that don't produce as much milk as the bulls that have horns. But in time, those bulls are going to catch up. And I would strongly encourage our producers to start thinking about ways in which they could include pole genetics in the herd to reduce the need for the dehorning procedure or disbudding procedures to be performed on their farms. The second is to substitute with a less painful alternative. And we've already talked about doing these procedures when the animals are young, because there's less pain processing that occurs in these animals. And we also were looking at alternative approaches, such as the use of a vaccine that directs antibodies against the reproductive hormones in the animal, which would reduce the need for castration. But the 2 S's that we're going to focus on in the next few slides are soothe and supplement. So what can we do to reduce the pain in these animals using a pain relief drug, either individually or in combination, which is the supplement approach, is using 2 drugs to have more of a beneficial effect than one. Next slide, please. So this is just a slide talking about how you would incorporate pole genetics, and there's different ways of doing that. Some of the more recent research is looking at removing the gene from the animal that produces the horns, and that's more of a gene editing approach. But there are bulls available that have naturally occurring pole genes in their genetic makeup, and we're encouraging producers to consider using those instead of having to dehorn. Next slide, Beverly. So this was a study that we published that you can find in Journal of Dairy Science, where we've talked about incorporating pole genetics into a dairy operation. And this will take about 10 years in order to achieve its end goal. But the sooner that you start doing this, the sooner you can achieve that goal of having a whole herd that's polled. This is also much easier to accomplish in Jersey herds compared with Holstein herds, because the Jersey bulls that carry the polled genetics tend to have a higher genetic merit compared to the horned Holstein bulls. And so it will be far easier for a Jersey producer to incorporate those polled genetics compared to a Holstein breeder. Next slide, please. We talked about substituting with a less painful method, doing these procedures as early as possible, and then the use of paste as opposed to hot iron. And we've also found that freeze branding is less painful than hot iron branding, so that's another option as well. Next slide, please, Beverly. So we're going to talk a little bit now about the drugs that you can use to provide pain relief. And as we acknowledge that the extent to which you as a producer will be able to adopt these interventions will really depend on the cost and the convenience of this approach. Next slide, please. So any use of a drug for pain relief currently on a dairy farm will require a veterinary client-patient relationship. So this is the first and most important thing to keep in mind when you're talking about pain management, is the drug must be prescribed by a veterinarian, must be manufactured in an FDA-approved facility. The producer must keep a record of the drug being used in an extra label manner. You can't use the drug in feed, and the veterinarian must provide a withdrawal period recommendation. And so this is a set of rules that surrounds the extra label use of drugs. And so I would strongly encourage you to have a conversation with your veterinarian to talk about what your options are to provide pain relief to be within the context of this extra label drug use system. Next slide, please, Beverly. So these are some of the options available for pain relief, and we're going to talk primarily in the next few slides about local anesthetics, and we're going to talk about a class of drugs called non-steroidal anti-inflammatory drugs, which are drugs like aspirin and flunixin and meloxicam, and we're going to talk more specifically about some of the information available on those drugs. Next slide, please. So for local anesthesia, this inhibits that acute initial pain. So again, going to the example of going to the dentist, the local anesthetic takes away the pain so the dentist can fill the cavity. The way in which local anesthetics work is they prevent the nerve impulse from being transmitted along the nerve fiber. So it causes a temporary loss of sensation in the area that's affected by that nerve. The local anesthetics typically take 2 to 5 minutes to take an effect. Again, getting back to the dentist example, and the activity lasts about an hour and a half or 2 hours. The way in which local anesthetics are administered is you administer 5 to 10 mLs halfway, on a point halfway between the corner of the eye and the corner of the horn. And so you can feel the bony ridge along the skull of the animal there. And just underneath that bony ridge is a little indentation. And so if you inject the drug just underneath that bony ridge, halfway between the corner of the eye and the corner of the horn, that's the optimal site for injecting the local anesthetic. And so this drug takes a few minutes to take an effect, but can be very effective if injected in that spot, just between the corner of the eye and the corner of the horn, just underneath that bony ridge. Next slide, please, Beverly. Sorry, we're good, thanks. So this is just a series of pictures that demonstrate that. So you start off by palpating that little bony ridge that runs from the corner of the horn to the corner of the eye. When you feel that little indentation just underneath that bony ridge, you insert the needle and inject about 5 mLs of the drug just in that particular spot halfway between the corner of the eye and the corner of the horn. Once that drug is injected, it will then have its effect. You can also put a little bit of drug at the back of the horn bud and at the side of the horn bud as well, because in some cases we can have nerve fibers that are coming from the back of the horn that can also be innervating that horn bud, that can make it a little more difficult for you to achieve the amount of sedation or pain relief that you would like to achieve. So injecting under the ridge and then a little bit at the back of the horn, a little bit at the front, typically 2 mLs at each of those sites is usually sufficient to be able to provide you the pain relief that you need. So next slide, please. So the advantages of local anesthetics is they're inexpensive. They cost about 30 cents a calf. You can get some products are actually cheaper than that. They reduce that initial procedural pain, so that acute pain associated with the procedure. They also make these animals much easier to work with, so it's a lot less stressful on the animal. but it does take about 2 to 5 minutes for the drug to take an effect. It does require some training for you to learn how to do this procedure, and the effect only lasts for a few hours, after which the pain starts to return. And so you really need to use another drug in combination with the local anesthetic in order to achieve the optimal pain management in these animals. Next slide, please. So this is what I'm talking about here. This graph shows the stress response in these calves. And when you use only a local anesthetic, the animals release stress hormones at about 4 hours after the disbudding. Whereas if you use a local anesthetic combined with a drug like Meloxicam, that reduces the stress and makes it a lot less stressful for the animal. And so that really helps in terms of reducing the pain and distress of the animal associated with disbudding. And next slide, please. So how we accomplish that reduction of stress is with the use of these non-steroidal anti-inflammatory drugs, or NSAIDs. And the three that I'm going to highlight for your attention are flunixin, aspirin, and meloxicam. And the main thing I want you to take away from this slide is the duration of activity of these drugs. And so when you look at the half-life, which is an indication of duration of activity, you'll notice that the drug meloxicam lasts for 27 hours compared with about half an hour with aspirin and between 3 and 8 hours with flunixin. So that single dose of meloxicam is incredibly effective at reducing the pain in the calf after that single dose. And so the drugs are given as these tablets at the time of the procedure. And by the time the local anesthetic wears off, there's enough meloxicam in the blood to be able to reduce the pain for several days after the effect of the local anesthetic has worn off. Next slide, please. So in terms of the costs, how much does it cost to use an NSAID in combination with a local anesthetic? Meloxicam tablets are incredibly inexpensive. So in addition to giving you the longest duration of activity, they also only cost about 15 cents for a 50 kilogram or 110-pound calf. So again, consult with your veterinarian, talk to them about the options that are available to you for pain management. But in terms of the biggest bang for your buck, these oral meloxicam tablets provide you with a long duration of activity for a very modest investment in terms of financial cost to reduce pain for several days after the procedure has been completed. Next slide, please. So as I mentioned, we only have this one FDA-approved drug, and that's Banamine transdermal. Next slide, please. And this drug is administered as a topical formulation. You pour it down the back of the animal. It's 1 ml per 15 kilogram. And it's important to realize that this drug is not currently labeled for use in calves. So if you want to use this drug to alleviate pain in calves, you should discuss that with your veterinarian, because that is considered extra labeled drug use. Next slide, please. So this is a picture of me administering the Banamine transdermal. It's administered the same way as you would ivermectin or some of the other topical drugs. And it's absorbed through the skin the same way as ivermectin is, and it provides pain relief for up to 2 days, a day to 2 days after the procedure. Next slide, please. So these are two, and if you could click it again, Beverly, that'd be great. So these are two video clips that show groups of calves that received the Banamine transdermal at the time of castration. And you'll notice that one pen of calves are up and alert and looking at the operator. The other pen of calves, there's a lot of animals standing still with arched backs and hunchbacks. And so it's very obvious from this sequence that the animals in pen A received the pain relief drug and the animals in pen B did not. And so you can see this very visual difference in terms of the way the animals are behaving, which shows you that these analgesic drugs are having an effect and making an impact on the animals on your operation, which is a really, really satisfying thing to see as a livestock producer. Next slide, please. So to finish up, I want to talk a little bit about meloxicam. Meloxicam is a prescription-only drug that's used to treat arthritis in people. These meloxicam tablets are very well absorbed from the gut of the animal. They're very inexpensive to use, and they have a very long duration of activity. So that single dose will last for several days. And we do have some guidelines for meat and milk withhold periods that I would encourage you to discuss with your veterinarian. Next slide, please. As we've talked about, the use of meloxicam in combination with the local anesthetic reduces that spike in cortisol, which is the stress hormone that occurs after dehorning or disbudding. And we also see less of a pain hormone called substance P and a reduction in heart rate in animals that receive the meloxicam compared with the animals that do not. So there's a lot of different indicators that we measure that show that meloxicam is very effective at reducing the pain associated with disbudding in these calves. Next slide, please. This is the slide that I think really matters for our producers. And so these are two different studies. The first study, we administered meloxicam to these calves that are up at the feed bunk. There are 6 calves in that pen. 3 of those calves received meloxicam at the time of disbudding, and 3 of them did not. And you'll notice that the calves that received the meloxicam are up at the feed bunk eating. The ones that did not receive the meloxicam are back in the corner of the pen, and they're not up and they're not eating any grain. And so the graph immediately below that picture shows the average daily gain and weight of those calves that received the meloxicam versus the ones that didn't. And you'll notice that the calves that got the meloxicam gained significantly more weight than the calves that did not. So in addition to seeing this improved behavior of these animals, you also see improved average daily gain and weight in the animals that received the meloxicam at the time of disbudding compared to the ones that did not. There's also another study that we conducted where we showed that the animals that received meloxicam at the time of castration didn't require as many antibiotic treatments for pneumonia or BRD compared to the calves that did not receive the meloxicam. So if you didn't give meloxicam, you used a lot more antibiotics in these animals for BRD than the calves that got pain relief. So taken together, these two studies really support that there could be an economic benefit for a producer to use meloxicam, in addition to there being the ethical consideration of these animals being up, eating at the feed bunk and feeling a lot better. Next slide, please, Beverly. So it is legal to use meloxicam under AMDUCA. You need to discuss this with your veterinarian. It has to be conducted under the oversight of a veterinarian. Next slide, please, Beverly. And we do have a letter from FDA that confirms that it is legal to use meloxicam in an extra label manner, provided this is done under the direction of a veterinarian and that this use does not result in the risk of residues in the animals that are being treated. Next slide, please. So to finish up, pros and cons of NSAIDs. The pros, they are inexpensive. They reduce that inflammatory pain. They make these procedures less stressful, and they potentially improve the average daily gain and disease incidence. But the downside of these drugs is they do require veterinary oversight. You do need to observe meat and milk withdrawal periods, and they are more effective if you use them in combination with that local anesthetic, which brings me to the final slide here, which is the slide about supplementing and using different drugs. So I have some information here about organic producers. Perhaps we could come back to this, Beverly, if there are any questions about the use of drugs in organic production. But these are some of your options that are available for organic producers. And the one I wanted to point out here is this compound called Dehorning. And the next slide, please, Beverly. There was some data that were just published here earlier this week that showed that Dehorning was not effective at reducing stress at the time of disbudding compared with the local anesthetic and a sham procedure where no disbudding was conducted. So the take-home message from this is if you're wanting to alleviate pain associated with disbudding, Dehorning would not be an appropriate choice under those circumstances, because this study supports the suggestion that Dehorning is not an effective reduction of stress agent in these calves. Next slide, please, Beverly. And this is just to finish up that we get more bang for our buck to use 2 drugs as opposed to 1. And the next slide, please. And this just demonstrates when it comes to stress reduction, this should be the opposite way. We see a lot less stress in the animals that receive both the NSAID and the local anesthetic compared with the local anesthetic alone or the NSAID alone. So we get far less stress in these animals that receive both the drugs versus just the one treatment or the other. And the last slide to finish up before we take some questions is just an acknowledgement. I want to acknowledge the funding that we received from USDA to support this research. I really appreciate your participation in the convo this afternoon. And thank you for the opportunity. And I'd be happy to answer any questions that you might have. So thank you for that.
Thanks, Dr. Coetzee. And we do have a few questions already. And just a reminder for those folks who are listening in, feel free to submit those questions either through the Q&A or chat feature on the Zoom side, or leave a comment on the Facebook Live. I have a few questions. The first one asks, is there sufficient amounts of data to show that paste is actually less painful than hot iron disbudding? Also, do you have comments on the data that shows earlier disbudding may actually increase sensitivity to pain later in life?
Those are both outstanding questions. So thank you for asking those. The data on paste is equivocal. Or I would say at this point in time, we really haven't had a definitive data study that has been conducted to show that paste is less painful. It certainly appears to be less stressful. It's easier to apply. In some of those studies where we have cortisol that's used as the endpoint to measure pain, we do see lower cortisol concentrations initially with paste compared to hot iron. But the key answer to your question is cortisol a good measure of pain? And that's one of the ongoing areas of research of a number of different groups, is to try to find a more accurate and more sensitive measure of pain so that we can really answer this question. My personal opinion is that paste dehorning is painful, or disbudding is painful, just as hot iron is painful. But I think the time at which that pain occurs is different. I think hot iron disbudding is painful when the iron is applied. But then the paste dehorning has more of a caustic effect, and so some of that pain is delayed until the paste starts to have its effect. And some of the endpoints that we use to measure pain just not sensitive enough to be able to assess that. So thanks for that question. The second part of your question about increasing the sensitivity to pain in later life, most of those studies have been conducted in situations where there have been sorry, a question just disappeared, but situations where it's been humans or other species where that work has been done. There are no good cattle studies yet that I'm aware of that has examined that. But certainly that is an area where there's some ongoing research to try to see if that does make a difference. Second question about the organic program certifying Meloxicam. Our primary challenge in that area is that we don't have a Meloxicam formulation that's approved for use in conventional dairy operations. We rely on extra label drug use under those situations. And so I think that we really need to ensure that when we look at Meloxicam, that we are in compliance with the regulations. And I think it would be really helpful if we had a Meloxicam formulation that was approved for conventional dairies, that we could then apply it to the organic program to get it certified for use in organic production systems. The next question is getting pushback about using pain mitigation with paste, especially if the paste is used in the first day or two. Would you have any recommendations around this? Maybe it can be answered by some of the other questions. Excellent question there. I appreciate that as well. Certainly there are sufficient data out there to suggest that paste dehorning is painful. I can refer you to some of those studies if you would like to email me privately. I'm happy to do that. But I think that certainly producers have a perception that paste is less painful because they don't see the aversive response in the animal at the time of the procedure like they do when they are doing a hot iron disbudding. But the pain associated with paste is really from that burning or the caustic effect that occurs afterwards. And so that's the challenge that we have, is measuring that pain and also being able to find a drug that's effective. And that's again where Meloxicam is really useful, is it provides more of that long duration of effect because it's more of an inflammatory pain with paste, and that occurs over some period of time after the paste is applied. A question about when using a butane hot iron dehorner, which method is recommended? Only to sear the ring through the skin around the bud, or fully burn around until completely removing the bud? That's an excellent question. And I haven't seen good studies that have compared those two methods. Most of what you would hear out in the field is the copper ring, where you get that brown discoloration of the ring around the horn bud, which people look for as an indicator that they've applied sufficient heat to kill the cells that produce the horn. And in that instance, I haven't seen an indication for scooping out the horn bud necessarily. And in our experience, just seeing the copper ring develop around the horn bud is usually sufficient to indicate that those cells have been killed. But there are still some producers out there that believe that you do need to scoop out the horn bud with the dehorning iron to be able to effectively dehorn the calf. My personal opinion is that that's not necessary. I typically use that copper test or copper ring test, which is searing the ring through the skin around the bud, to be sufficient for disbudding. In our experience, we haven't seen the horns grow back after you do that. So I don't personally believe that scooping out the horn bud is necessary, but there are still some producers out there that believe that that is critical for the success of the procedure.
Thanks, Dr. Coetzee. And I'm not sure if you saw, there was also a question in the chat inbox that asked, what was the absolute earliest age you can safely and accurately disbud a calf?
That's an excellent question, and that question becomes more difficult in dairy operations where they have some polled genetics present. And so very often producers want to wait to see whether that hornbite is starting to develop, before they make the decision to disbud, in case that's going to be a polled calf, and they want to make sure that that's the case. Certainly, I would wait until the calf has had colostrum, that there's been a passive transfer, that the calf has been able to stabilize. So waiting at least 48 hours is important for that process. And then also, if you can palpate that little nodule in the skin that starts to develop at the point where the hornbite is going to develop, that's also very helpful, so that you can accurately apply the hot iron to the surface of the skin. But from a safety perspective, certainly making sure that that animal has received colostrum and has got its immune response intact before performing a very stressful procedure like disbudding is best practice. But I generally would prefer not to wait longer than a week in those, if you possibly can, because I do think that there's value in minimizing the duration of the procedure in those calves when they're very young. But as was pointed out in an earlier question, there are some data to suggest that these animals may be hypersensitive later on, but we have not really been able to quantify that with the research that we've conducted to date.
Thanks, Dr. Coetzee. And I think that we are a little past time, and I'm not seeing any questions coming in that are there now. So thank you for your time today and for sharing that information. There was a lot of good information that was shared. As a reminder, if you're listening in, if you want to share this recording with someone else, if you want to go back and rewatch, because there was a lot of information kind of fast, it will be, the recording will be on our website along with some additional one-pagers and information. If you want to reference that. And just as an FYI, we will have our next conversation in this series on the 24th at 2:00 p.m. and we'll be discussing implementing safety protocols. If you have any other questions or would like to reach out for any additional information, please feel free to send us an email and we can connect you with Dr. Coetzee as well. Thanks, everyone.
Thank you.